Good evening. My name is Nancy Hicks, and I completed my practicum project on post-discharge follow-up calls. The facility this was completed at was a St. Luke's Jerome Medical Center. This is a critical access hospital in rural Idaho. There are a few departments within this hospital. There is a medical surgical unit that is combined with our swing bed program. The average census lately has been about 14. Our departments are a 24/7 emergency department. We also have an outpatient infusion department, as well as some outpatient services. So to provide some context about Jerome, Idaho, the population as of 2023 is 11,038, and the demographics are 59.5% white, 37.4% Hispanic, and 2.5% it has two or more races. So how did this project come about? So as a nursing leader, I am the nursing manager at St. Luke's Jerome, and one of the metrics that we look at is our patient experience scores. And so our vendor is Press Ganey, and this is data that has been pulled as of March 24th. And our health system looks at the likelihood to recommend on the Press Ganey scores or the Press Ganey surveys. And so as you can see on this slide, our current fiscal year to date likelihood to recommend is 60.87% compared to the previous year, which was 68.83%. And just to provide a little more context of the previous years, you can see that 2023 was a great year at 75.86%, but we were generally in the mid to high 60s. At one point this fiscal year, we got down to 55%, and so this is something that was really important to myself and our facility to increase these scores. So as I started to do some digging, I found that on our inpatient surveys, this is just a snippet from some of the questions of the HCAHPS, but here you can see that we are in the first percentile rank when it comes to discharge information and care coordination. And so that's really the primary driver of how this project came about. So here's a needs assessment that I had completed. This really goes through, as you can see at the top, current state, desired state, and goes through all these kind of components. And really the gap that was identified in completing this is that we are assuming when a patient is discharged from a hospital that they are fully understanding their discharge instructions. And so really the goal is to kind of smooth out and streamline that discharge process from post-acute or inpatient to their home setting. Another component of this is because we have a swing bed program within our hospital, that is a post-acute care that we're providing. And so if a patient is in an acute care setting, that care transition from post-acute, and then they're having another care transition into their home setting. And so these patients have quite a few care transitions that they're navigating. And so really just highlighting the importance of, are we making that transition as smooth, efficiently as possible that we can for our patients. So that is the project topic, is providing those post-discharge follow-up calls. These calls are completed by the nursing leadership team, which consists of myself and the assistant nurse managers or the A&Ms. So just some data within our facility, as this is a 2025 calendar year, our average daily census is about 7. We have recently grown our unit, and our average daily census is now 14. And so just wanted to provide some context here as I will share later in the presentation. So what are the goals? Why is this important? So first and foremost, it's always going to be to improve patient outcomes. How can we optimize the care that we provide while decreasing readmission rates? I had mentioned that patient satisfaction was the initial outcome that I was looking at. and then, of course, streamlining care transitions, and then identifying and addressing issues early on so that we can prompt early intervention to get the patient to the right place with appropriate follow-up as soon as possible. So the implementation plan really consisted of 3 components. There was a preparation, execution, and evaluation phase. So the first part of this is the preparation phase. And that was developing the script and providing the education to the A&Ms. It was ensuring that there was an ability or a way to pull all of the discharge patients on Epic, which is our EMR, which was a report I was able to pull. And then creating a tracking system for us nursing leaders to be able to track this information. And so we did that by using a shared Excel sheet. Here's the script. The most important part of the follow-up call was really to address the patient's specific needs. Some patients didn't have all of these components that were needing to be addressed. For example, medications. Others wanted to focus on specific components. And so really the goal for our leadership team was to personalize this callback to whatever the patient needed. But in general, we really wanted to address if their symptoms were being managed well. Did they understand their discharge instructions? Were they able to fill their medications, schedule any follow-up appointments, or if they had any other questions regarding their care? So the second part of this was the execution phase. The scheduled go live was tentatively scheduled for April 1st, but we had a CMS survey hospital-wide, and so I pushed that back 2 weeks later. So during this, when we did go live 2 weeks later, the patients were called back during normal business hours because it was done by nursing leaders. And we were able to call back 94% of the patients. Not all of them answered the phone, but those calls were completed. The reason why we weren't able to call 2 patients back, or that we didn't, is because they were readmitted into an inpatient unit. So this is the data from 4 weeks of collection. 35 patients were discharged in this 4-week time frame. 28 went home. Again, 2 were admitted to an inpatient setting, and then 5 were discharged to another facility. So out of those 33 patients, 17 answered the phone, which is a 52% percentage. The feedback when completing these calls was overall pretty positive. The patients, some of them were a little hesitant initially when answering some of these questions, but as we were asking some, a lot of them got a little more comfortable and felt a little safer kind of answering those questions. And then the third part of this was the evaluation phase. I talked about the data collection, the stakeholder feedback. The 2 primary stakeholders were the A&Ms and the patients. The A&M feedback was really that it was time-consuming and difficult to prioritize. I had mentioned that our census has increased. We have pretty much doubled our census, and with that comes a lot of the operational challenges, from staffing to equipment to whatever else comes up. And so the A&Ms really struggled in their day-to-day to be able to complete this and prioritize it. They know how important it is. It was just a challenge for them. And then the other stakeholders would be the patients. It seemed like they did enjoy getting the callbacks and the follow-up, and appreciated that touch point. So how can this be sustained, and what were the learnings? The really key part of this for sustainment is leader accountability. It's ensuring that there is a designated leader accountable to this, to completing the callbacks. I had found that initially when we had shared the workload, it wasn't as successful, because by the end of the day, it's more of a conversation of, did this get completed, when it's a shared responsibility versus assigning it out. And so what we had decided to do as a team is that whoever was on call that week would be completing the callbacks for that week. Another important part of this was we had found that when we were rounding with them, when they were in the unit, we were able to make a connection with them while they were here. So when we made that follow-up call, there was already that connection established. So the callback seemed to go a little more smoother because they felt like they could trust us and had that connection already established. And then just moving forward for sustainment, it would be really important to share the data, share those wins, those stories to one another in order to keep this successful. And here is the references, and that is all I had. Thank you very much.